GLG, so we've got some background, but it's always more helpful to hear it in person, I think.
Okay, so my name is Guillem, and I'm a young surgeon. I do ophthalmology. I studied medicine in the University of Barcelona for 7 years, and then after I started ophthalmology in one of the biggest hospitals here in Barcelona, which is Hospital Vall d'Hebron, for 4 years, and that's like the basic formation for the degree of ophthalmology. And after I started my degree to become a doctor, which I'm still doing it, and I started to work in a private center called Clínica Baviera, which is one of the largest in Europe. And now I have some experience there, so I did some years at the public health system here in Spain, and also now I have some experience also in the private center, which is quite different. And so I do eye surgery for 5 years now. And I have some experience with IOLs as I'm implanting them on patients, and I also can see the results. I use like different kind of IOLs, so I know like how they work, like the theory, and then in the practical setting, I can see how they work, and also like the results. So I think that if you need some information about lenses, I can give you my point of view as a surgeon.
As a doctor. I think that'll be very, very, very helpful. And I think that the types of things that we're keen to discuss with you is basically sort of how do you assess the quality of a lens, how do you measure patient satisfaction, how do you decide between what type of lenses to use, and those types of things basically. And I think that'll be a very, very helpful discussion for us, and I'm sure that you have lots of very, very interesting views on that as well. But maybe before we go there, I wanted to quickly touch on one other aspect, and that is basically, so you are you do eye surgery, and does that include both cataract surgery and refractive surgery?
Yeah, because nowadays the cataract surgery is like a part of the whole refractive surgery, because we do like laser, but that is in the cornea, so we are not using lenses. It's an external surgery, but also we do intraocular surgery, which means like touching the eye inside, and then sometimes we put lenses, sometimes we do not. But the refractive surgery nowadays include the cataract surgery, because the patient doesn't want only to take out the cataract, but he wants also to like see good in far vision and also in near vision. So we have to like calculate a lot of parameters of the eye before operating and choose like the right lens to put. And we do surgery in people who has cataracts, but also in people who does not have cataracts but have, like, for example, presbyopia, and we are using multifocal lenses, for example, to correct this aspect.
So I've got a few questions on this, if I may. So, out of the people that come to you with presbyopia, or sort of people needing refractive correction, broadly, how much of that will be done by LASIK, and how much will be done by IOL? Is that 50-50, or is it like 80-20, or how should we be thinking about this?
Well, the most important thing when we see a patient is, first of all, the age, because in young patients we tend to use like 80% laser and 20% lenses. In fact, we try to do laser on young patients, and it's only on the people